right, so as Hunter comes in, Hunter, why don't you come on in? You can come and sit down over here. As he comes in, I'm noticing his gait is steady, his posture is good. You can go ahead and sit down. I'm noticing that Hunter is clean, his nails are clean, he's got clean clothes, he's making good eye contact, and he's smiling nice. So we're going to look at Hunter's lungs and chest. We're going to listen to his heart. We're going to check the peripheral vascular system, and we're going to check your belly. So why don't we first start with your lungs if you want to take off your shirt. And for your lungs, we're going to use auscultation, percussion, palpation, and inspection. So when he first takes off his shirt, we're looking at the symmetry of the chest, we're looking at the posture, and then we're looking at the AP lateral diameter. Hunter's AP diameter is smaller than his lateral diameter, which is normal. If the AP diameter is greater than the lateral diameter, then that could indicate COPD. We're also looking at the chest for any difficulty breathing. We're looking at the respiratory rate, and if there's any ribs showing or any retracting when he's breathing. And Hunter, I'm going to have you slide over just a little bit so I can sit down next to you. And I'm going to have you turn to face that way a little bit so that we can videotape. And I'm not sure for this part, if you come around the back side of the bed, that might be better, so that you're over here. So one of the things that we're going to do is to palpate for tactile fremitus. And I'm going to lay my hand in Hunter's back. We're going to go in 10 different spots, and he's going to say the word 99. So Hunter, every time I move my hand, you just say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Good, and Hunter does not have any tactile fremitus. Next, we're going to palpate for symmetry. I'm going to put my thumbs facing inwards at the level of T9. I'm going to bring them just close enough together to pinch, and then I'm going to have Hunter take a nice deep breath. Go ahead, Hunter. And I'm noticing that my thumbs are moving apart symmetrically. Next, we're going to percuss. We're going to look for resonance throughout the lung fields. I'm going to use my non-dominant hand. I'm going to place my middle finger down, and we're going to go systematically from top to bottom while moving left to right and comparing both sides. We're going to go between the ribs, not on top of them. And we're looking for resonance throughout. Next, we're going to do a test for CVA tenderness. Hunter, do you have any pain with that?
No.
No. How about there?
No.
No. Okay. And you can turn back forward. And if you come back around this way. Now we're going to look at the anterior chest. We're going to auscultate. We're going to listen to lung sounds on the front and on the back. So Hunter, we're going to start with the mid-clavicular line and make our way down. Nice deep breath through your mouth. We're going to move from left to right so that we can compare between the two sides. And we're going to leave our stethoscope in place until the exhalation is complete. And we're listening with the diaphragm of the stethoscope. We're also going to listen to the lung fields on the back. So I'm sure if we could turn again. We're going to start at the top and make our way down. Breathe in through your mouth. Corona distraction. So Hunter's lungs are nice and clear. Now we're going to look at your abdomen. So I'm going to have you turn, and you can bring your legs up onto the bed. Of course, the phone rings. So for the abdomen, we're going to inspect, and then we're going to auscultate before we percuss or palpate, because we don't want to create any fake bowel sounds. So on inspection, we're going to look if the belly is scaphoid, flat, rounded, or protruding. Hunter's belly is nice and flat. We're looking to see if there's any masses, any signs of hernias, any scar tissue, any piercings, any striae, or any unusual pulsations, and Hunter does not have any of those. So we're going to listen to your belly in several different places, okay? We're going to start in the right lower quad where the ileocecal valve is, and we're listening for low rumbling in each of the quadrants. If we don't hear any bowel sounds, we have to have an absence of bowel sounds for 5 minutes in order to record that there's an absence of bowel sounds. And Hunter has bowel sounds present in all 4 quadrants. While we're listening to the bowel sounds, we can also listen for femoral, renal, and aortic bruits. Our renal bruits will be in the left and right quadrants, aortic midline, and for the purpose of the video, we're not going to take Hunter's shorts down, but we can listen in the groins for the femoral bruits. Okay. Next, we're going to percuss the abdomen. We're looking for tympany throughout. Again, we're going to use the middle finger of the non-dominant hand. Any dullness could indicate a tumor or an organ. Up by the liver, we're going to hear a little dullness. We're making sure to go out all the way to the lateral edges of the abdomen. And Hunter has good sounds throughout. Next, we're going to do palpation. We're going to do light palpation to assess the upper musculature. That's going to be about 1 centimeter deep. And Hunter's going to let me know if he feels any pain with any of the palpation. And his belly is soft, non-tender. Next, we're going to do a deep palpation after we go all the way out to the edges. Deep palpation is going to be about 5 to 8 centimeters. With deep palpation, we're assessing for masses, and we're assessing organs. For the liver, we're going to slip our left hand around the back, around the 11th rib, and we're going to palpate up to feel the edge of the liver. And note any enlargement. And we'll make our way over to the spleen. Reach the left hand over, slightly lift the body. We should not be able to palpate the spleen, and some people you can palpate the tip of the spleen, but usually it's non-palpable unless it's about 3 times its normal size. And last, we're going to test for rebound tenderness, which would tell us if there's any peritoneal inflammation. And with rebound tenderness, we're going to press in. There's no pain with the pressing in, but when you release quickly, there's pain with the release. And do you feel any pain?
No.
No, okay. Next, we're going to look at the peripheral vascular system. We're going to make our way down and palpate all the pulses. Again, for the purpose of the video, we're not going to take Hunter's shorts off, but we're going to palpate the left and the right femoral pulse. We're looking for symmetry down the legs. We're palpating the popliteal pulses. And we're noting, are they present? Are they normal? Are they weak? Are they bounding? We're looking at the dorsalis pedal pulse. And checking capillary refill. Looking to see that the legs are symmetrical in size. Then we're going to look for any swelling or edema. checking behind the ankles and on top of the shin. And Hunter does not have any edema, he does not have any varicosities, he does not have any hyperpigmentation or color changes. His legs are the same temperature. And we're going to check pulses up top. We have the temporal pulses, and they're both the same. We're going to check our brachial pulses. And our radial pulses. And Hunter does not have any swelling in his extremities. Nail beds are a good color. And hands are both warm bilaterally. Okay. Next I'm going to have you sit up. We're going to, actually no, you know what, I'm going to have you stay laying down. I'm going to bring you back to about 30 degrees. So for your cardiac assessment, we're going to go back to about 30 degrees, okay? And we're going to assess the carotid arteries. We're going to look to see if they're distended. And Hunter does not have any distension. We're going to palpate the carotid arteries one at a time, not both at the same time. We're going to note if they are weak, if they're bounding or regular, and Hunter's are regular and they're the same on both sides. Then we're going to look at the jugular veins. We're looking for any jugular vein distension or any unusual waves or pulsations. Hunter does not have any distension. He doesn't have any waves or pulsations. If he did, we would measure the jugular vein distension. We would go to the suprasternal notch, measure at 90 degrees with a flat surface like a ruler, and it should be less than 2 centimeters. We can also auscultate for carotid bruit with a bell of a stethoscope, and we can listen to see if there's a bruit. Next, we're going to listen to the heart sounds. We're going to go down to the right second intercostal space. We're going to be listening to the aortic, pulmonic, tricuspid, and mitral valves. And the second intercostal space on the right is the aortic valve. We're listening with the diaphragm for S1 and S2 sounds. S2 should be louder than S1 in the aortic valve. And then we can depress and listen with the bell of the stethoscope for S3, S4, and murmurs. And we move over to the pulmonic. Same thing, listening for S1 and S2 with the diaphragm. Listening for S3 and S4 with the bell or murmurs. And moving down to our third and fourth intercostal space for the tricuspid. And here S1 and S2 should be about the same. Listen with the diaphragm for S1 and S2, and then with the bell for S3 and S4. And we'll move down to the fifth intercostal space to get the mitral valve. And the mitral valve S1 is louder than S2. We listen for the diaphragm with the diaphragm for S1 and S2, and then with the bell for S3 and S4 or murmurs. And then I'm going to have Hunter put out his left arm and roll up onto his left side slightly, and this will bring the mitral valve closer to the surface, and we can listen to the mitral valve a little more closely. And Hunter does not have any S3, S4, or murmur, and I'll have you lean back. And then I'm going to have you sit up. And come around that side, Mom.
Okay.
And here we're going to have Hunter lean forward slightly, just slightly. And we're going to go back to the aortic area, and we'll listen for any aortic insufficiency with the bell of the stethoscope. Okay, and I don't hear any. And then you can sit up. And we're going to palpate the apical impulse. That will be down the midclavicular line at the fifth intercostal space. It's about 1 to 2 centimeters wide. And it should match the carotid pulse. And it does. And that's all.
Done?
Yep.